In this clinical teaching guide, we will focus on principles of clinical teaching. Although the clinical environment is busy, it's the best environment for students to learn since they can witness disease processes in real time and gain relevant, valuable experience. The 6 assumptions of adult learners are listed below according to adult learning theory. The experiential learning model demonstrates how adults learn through experiencing, imagining, reflecting, analyzing, thinking, deciding, acting, initiating, and balancing. Let's walk through this flowchart demonstrating the philosophy of learning. The experiential learning cycle involves a concrete experience that is followed by reflective observation. After observing, the learner develops an abstract conceptualization, which leads to active experimentation and back to experience. The first step is for the learner to identify the gaps in their knowledge. Learners must be in a psychologically safe environment in order for this to be effective. Ask questions to assist the learner in identifying these gaps and avoid demeaning or disrespectful comments. Next, the learner must find their own motivation to set goals and prioritize their learning. Motivate learners by sticking to relevant information and referring to relevant, trustworthy sources. You can also assist learners with goal setting. Next, learners must conceptualize the lesson and apply it to real-world situations. Center your teaching around authentic scenarios and collaborative learning. Remember that learners will pick up on the behaviors you model. Therefore, it is crucial to model good behavior in the clinical setting at all times. Lastly, students must practice what they've learned in order to continue learning. Encourage the learner to actively demonstrate the learned material, all while giving feedback to the learner accordingly. Let's have one last look at the philosophy of learning flowchart. Learners must identify the gap in knowledge, find motivation to seek the next step in learning, accept responsibility for self-comprehension, and practice learned material while committing to further learning. Here are the takeaways from this guide. Learning in the clinical environment is very challenging, but also very rewarding. Start each session with gap identification. Ensure that students know what is relevant and why. Foster a safe learning environment for an optimal learning experience. And finally, give feedback freely and often. This video is produced by the Office of Faculty Affairs and Development at the Burnett School of Medicine. Thank you for watching.